Penile schwannoma could disfigure a handsome penis. Beauty is only skin deep, but when it comes to having a handsome penis, that can be deep enough. Penis health is, of course, much more important than the physical appearance of a member, but the fact remains that a handsome penis is going to elicit considerably more interest among partners and especially among potential partners. Thus, when something comes along that interferes with its appearance, it can be a detriment to a man and his sex life. This can easily be the case with the appearance of a penile schwannoma, which can cause a disfiguring look to a healthy penis. Schwannoma? Most people have never heard of a penile schwannoma, or of a schwannoma of any kind, and with good reason. It's pretty rare. But rare is small comfort if a man happens to be one of those few whose penis is host to a schwannoma. But what is a schwannoma anyway? To answer that, one must know a little bit about nerves. Most people know that nerves are the parts of the body that pick up stimuli, such as a touch, and send a message back to the brain, thus prompting a response. The penis has especially sensitive nerves, which is what makes touching or fondling it so enjoyable. Every nerve in the body also has what is called a nerve sheath, which is essentially a layer of protective tissue which keeps the nerves safe. When a person has a schwannoma, it means that a tumor has developed in a section of nerve sheaths. This occurs only in nerve sheaths that are part of the peripheral nervous system, meaning that they are not directly in the brain or in the spinal cord. That sounds terrible, but the good news is that schwannoma are benign tumors, not cancerous. But they may be accompanied by a burning or stinging sensation or, alternatively, by numbness, neither of which is wanted in the penis. And they can disfigure a handsome penis because these tumors can sometimes get quite large. A very small one might just look like a little bump, but larger ones can be several inches in size, hard to ignore, even on a really big penis. Even when they are not causing discomfort when the penis is at rest, they often can become painful during sex, and if too large, can make penetration impossible. What to do? If a man has what he thinks could be a schwannoma on his penis, he should definitely take a trip to the doctor and get a proper diagnosis. If it is determined that the lump is schwannoma, the only real treatment option is surgical excision. This is usually not a difficult surgery, and sometimes requires just a local anesthetic. There is, however, risk of nerve damage as the removal of the schwannoma could require impacting the nerve underneath the sheath. If the tumor is very small and is not causing discomfort or pain, the doctor may recommend simply monitoring the lump. Although generally benign, if for some reason a doctor suspects it may be malignant, however, then he will recommend removal even if it is causing no physical problems. Removing a schwannoma may restore a handsome penis to its former state, but it still needs its health attended to. Regular application of a top-drawer penis health oil, health professionals recommend Man 1 Man oil, which is clinically proven mild and safe for skin, can help. In order to give the penis optimal benefits, the BETS oil will contain a range of vitamins, including A, B5, C, D and E, and it helps if the oil contains L-carnitine, an amino acid which aids in maintaining appropriate penis sensitivity.